My mother, 15 years ago, she flew to New York and went on this course, had said to me, I think you need to go do this course. And I was the youngest female English dentist, all American plastic surgeons. I felt like a fish out of water. For me, it's all about proportion and balance and harmony. When something is out of proportion, one's eye notices that more. So if you've got massive lips on a tiny face, that's out of proportion. The more you know about the risks of what can happen, the more anxiety you get, even as a professional, because you know what complications can occur. Then a little bit of work that I did then has aged really nicely with them, and they still look like them, but a better version of what they would look like, a good 47, rather than a 47-year-old child at 22.
Our guest today is Dr. Krystyna, the London and Ibiza cosmetic dentist and facial esthetician whose natural, refined results have made her one of the most in-demand names in the industry. She trained everywhere from Harley Street to New York, built a loyal Instagram following, and even spent part of each year volunteering her skills in refugee camps, providing dental work. Today, she's here to share what it really takes to stand out in aesthetics and her unfiltered thoughts on safety, social media, and where the industry is headed. First question, you built a really unique career in cosmetic dentistry and aesthetics, but how would you describe what you actually do?
That is a really good question, because I do both of them at the both advanced level. What I've noticed in kind of like my industry, you've got dentists that kind of dip a toe in the aesthetics world, or you've got aesthetics doctors who obviously don't do dentistry. But for some reason, the way my career went is that I just did both of them alongside each other. And actually, that's what really helped either of them advance to the level that they're at now. So when people ask what I do just say, well, Dr. Krystyna, the cosmetic dentist and facial esthetician, I give them both their kind of position.
What was the reason that you decided to actually get into the aesthetics world? Because I know you originally trained as a dentist.
Okay, this is a really good story. I'll try not to sit too long with it. But both my mother and father are dentists. And my mother, she's very smart and she's very beautiful. And we as a family of all females, apart from my father, do like to look good and feel good. And when I qualified dentistry, so I was a little pup, my mum actually wanted to get some work done. But she was like, I don't want to pay someone to do something that I could do. I want to cut out the middleman. And this was a long time ago. It's about 15 years ago, before it was considered that dentists could do aesthetic. We were just considered teeth. So she flew to New York and went on this course. And she came back, looked amazing because she'd had the work done, and said to me, as I was qualifying dentistry, I think you need to go do this course. And I think you need to look at this because I think this is where stuff's going to happen. I didn't know what she was talking about, but I always listened to her, just a very powerful woman. Flew to America, did the same training, and it's a very, very intense course. And I was the youngest female English dentist, all American plastic surgeons. I felt like a fish out of water. But what was really interesting is that I picked up everything so quickly, mainly one, because my anatomy knowledge was so fresh from doing my finals, but two, because of my dexterity from working with needles inside a mouth. So it all kind of blended so nicely. But interestingly, when I came back to the UK and I told people that I was offering this service, I wasn't really considered. A lot of people would say things like, oh, you have Botox tattoos. I don't understand. So I kind of effed it for a bit. And it wasn't until I started having the work done to myself, by myself, that I can start to pick it up again. So it's a very long story. So that's kind of how I got into it, from my mum, her being clever, and me actually realizing that I had got a skill with it, but not quite working out its place. So to actually incorporate it into my career and actually give it that space, that was where the work came. That was what was the tricky part.
Following from that, you mentioned that your knowledge of facial anatomy kept coming from your dental background. Yeah. So would you say anything else, or that included, as something that really helped you to become good at this specific industry?
I think there's a number of factors. You can be very textbook with aesthetics, A, B, C, 1, 2, 3, but is that giving the patient the bespoke treatment? No. So obviously, yes, I know my anatomy from a textbook point of view, but I have to give myself a bit of credit here that I do have an aesthetic eye. I am into beauty. I like to have my hair done, my makeup done. I used to contour my face with makeup. So I think there's an element of that that's wrapped up into it as well. But yeah, of course, like the dental knowledge, how to speak to patients, how to prescribe, where the muscles sit, what that looks like, obviously has had massive impacts.
That's very interesting that you say that. I've actually had procedures done both by non-medical practitioners and medical practitioners. And I would, like, being completely honest, I have had some botched jobs done. I don't know if you can even tell at the moment, but
you're beautiful.
But one thing I did notice is that I assumed that these are medical practitioners, so they would know exactly, like, I wouldn't have a botched job. But then I did end up having one. So it's interesting that you mentioned the aesthetic eye. Like, what would you say the aesthetic eye is, and how would you describe it?
That's a really, really good question. And firstly, I want to say I'm sorry that you've had botched jobs. I've had personally as well, things happen to me, even by medical professionals. You know, there's botch and then there's risk and complications. And you can be at the top of your game and still get risk and complications, which is why I do find it fascinating that people are willing to see people who are not medically trained, because risk and complications happen to everybody, every professional, every non-professional, but it's the professionals who know how to deal with it. So I'm really sorry you went through that. The aesthetic eye, I think, again, how do you describe what someone can see? But for me, it's all about proportion and balance and harmony. Okay, so this is what I do at a dentistry as well when I'm designing my smiles. When something is out of proportion, one's eye notices that more. Okay, so you know something called the golden ratio, the golden proportion. A really basic example, the pyramids in Egypt are based on that. So when you look at them, they're really beautiful. They're really soft to the eye because everything is in balance and proportion. However, if something is out of balance, your eye is more drawn to it, but in a confused kind of way. So if you've got matted lips on a tiny face, that's out of proportion. And I think a lot of people, and I'm not stereotyping or generalizing, but you know, there are even people who are who are medical professionals who don't have an aesthetic part to their career, don't necessarily pick up on those nuances. So if I look at you, you've got really lovely round features, you've got big round eyes. I'm not going to make your lips look really pointy and sharp. It's out of proportion, it's out of harmony. I guess that's something you just know if you know, and then investigate and delve in further if you're interested in it.
The UK is actually bringing out new regulations and rules on who actually should be providing injectables, who should be doing injectables or any other medical aesthetic treatment. What are your thoughts on this? Do you think this would make the industry safer?
I think it's been a long time coming. I understand there's going to be a bit of backlash with stuff like that too. For me, I remember speaking personally to a non-medic injector, and she was like, I never get nervous injecting patients. And I was like, that's because you don't know enough. The more you know about the risks of what can happen, the more anxiety you get, even as a professional, because you know what complications can occur. So it is that classic ignorance is bliss. So if you don't know what an occlusion looks like, as in when you inject filler into a gum vessel, which can be highly detrimental to the patient, then you're just going to go bam, bam, bam and inject, okay? If you don't know how to prescribe antibiotics to someone's got an infection, that poor person's going to suffer. So yeah, these laws are a long time coming. Do I think they're going to make an effect straight away? I don't know. I hope so. I mean, there's already prescribing laws out there, but there's still people who are non-medics who are managing to get their hands on Botox. So there's always going to be, I guess, people who can do workarounds. But I hope it makes the general public take our industry a bit more seriously for themselves. That's the main goal.
So these sound like really serious complications or risks that could happen. If it's not just, okay, your face looks not so good and not happy with it, that's obviously an issue. But these sound like serious. It have an issue, but these sound like serious risks. Why do you think this hasn't been considered before?
You tell me, babe. I have no idea. But again, perhaps because people don't talk about it as much. What I find really interesting is that obviously if you want to have plastic surgery, you automatically know to go to a doctor. You're not going to not go to a non-medic for that. So I think aesthetics, because of how it's started, where it started from, perhaps wasn't immediately put into the medical category. So therefore there was this kind of grey area. Yeah, having a botched job, in my ears, when I hear the word botch, I think of complication. I think of necrosis. I think of it, infections. But some people just think, oh, it didn't look that good. But there are other complications, like you can get droopy eyebrows from a badly done Botox. You can get lump on the lips from badly done lip filler. So yeah, it's just kind of differentiating what is considered like a complication and what isn't, and what's considered botch and what isn't. But yeah, we have to kind of take it all as a bigger picture here.
If you've had people coming in that have actually had previous work done and it's gone wrong, what's the most scary complication you've seen and had to deal with?
I'm really lucky, touch wood, gosh. I haven't seen or had myself any major complications. But what I have picked up a lot of is where people have overfilled their face at a very young age from these clinics that basically do the point and shoot. When you go see someone for aesthetics treatment, yes, obviously you come with a complaint. I feel that my face is losing volume. I feel that I'm sagging. I feel that I look tight. Whatever that is, it is our duty to assess you and tell you what you can have done, what won't be possible, and what is the right treatment at the right time for you. You're not telling me that you need cheek filler. Do you understand? So where I was picking up a lot of cases is where people were just wanting cheeks. They want cheeks, but they already have big cheeks. They can see me with these big, like, egg balls of filler on their faces. And they're like 24. That's not going to age well. They're kind of alienized. Their faces, they don't look like themselves. And that's really scary, because then obviously you have to think about how you're going to remove all that. And then what are you going to look like after all that? So it's a real journey. So they're the kind of things that I picked up on that actually are quite sad, because people are starting to not look like themselves.
What you just mentioned of these kind of extreme cases where people sometimes might take it too far is what kind of is portrayed on social media and things, and what is actually quite a big fear for some people in this industry. Why do you think it gets to that situation, gets that far?
I think that's really down to the responsibility of the injector, really, truly. Like, I have a lot of patients here that get really miffed with me because they're on a filler ban or a Botox ban, and they'll ring up and want to book in for something, because a lot of people want it just for a fix to feel good. I'll get my lips done, I'll feel great. That's not really necessary. Maybe go for a facial, maybe go to the gym, and I'll have a look when they had last had it done. If it's too, I might do it. So it is my responsibility to cut people off, because this stuff is addictive. Okay,
telling someone no to filler, how did they take it?
Oh my God, they hate me. But then they obviously appreciate it. And at least, look, at the end of the day, without trying to sound too crude, like, I'm turning away business, aren't I? Which is why I drive a Golf, not a Ferrari. Never mind. At least I could sleep at night. I think short term, they're probably a bit miffed. Long term, they're grateful. And I have patients that have been with me throughout my whole aesthetics career. So not only am I looking after them for how they look now, I'm thinking about them for the next 2, 3, 4, 5 years. And we've grown together, and we've all aged together. And it's actually really beautiful, because I'm seeing some of my work last. I'm seeing how it's working with their aging. A lot of patients want to come in and, I'm not a big fan of these come in, get 10 mils in your face, walk out 2 weeks later, look like a different person. That's just not how I work. Okay. I don't discredit that. That's how some doctors work. I'm here to learn often, as of when. Okay. So what I've noticed with having patients for so long is that a little bit of work that I did then a couple of years ago has aged really nicely with them. And this will look like them, but a better version of what they would look like. So a good 45, a good 47, rather than a 47-year-old trying to look 22, which would require me to be constantly treating and constantly filling them. It's not like that. So how we work here is I say to patients, come and see me once every 4 to 5 months. We'll assess the face. Sometimes nothing needs to be done. So we just have a really nice chat, which I'm good at. Or if I'm like, no, we don't need to top that up yet, or that's stabilized, or that's you can go. Maybe we put you in for a skin treatment. Maybe we talk about skin care. Maybe we do a skin booster. It's treating as we see fit.
So there are 2 different types of medical aesthetics. There's the injectable side, then the skin rejuvenation side. What do you think the balance is that you usually see people coming in for?
Okay, so that's shifted over the years, most definitely. And I can say that because, like I say, I've been in this game for a long time now. I think skincare and skin treatment used to be considered just fluffy facials. That has now advanced to more like cosmomedical facials. So microneedling, which, yeah, we're not going to get a rubber dub and a nice little back rub, but you're going to get treatment to your skin, which is going to have an effect. Hydrofacials, all that kind of machinery-based stuff. But that wasn't considered before as like aesthetics. And then previously it was just Botox and fillers. Obviously, with that softened to more like skin boosters, polynucleotides, all these kind of things, which actually aesthetically rejuvenate the skin from a cellular level, like biohacking the skin. And then of late, I'd say in the last couple of years, the two combined together have now become a kind of bubble in itself. It's the whole kind of trifecta, the skin.
So being a doctor and seeing all of these new types of skincare, the latest health trends and things like that, how do you personally decide if this is something that is a good kind of procedure to offer your patient?
That's a really good question as well, because we are completely overwhelmed and influxed constantly by the latest, the greatest, the newest. And it's not always the case. Me personally, I'm still using the same skincare I have for the last 6 years, Obagi. You know, it's not something that's in Space NK. It's not cool. It's not trendy, but it works and it's consistency. But I completely hear you. We are overwhelmed. So how we work here is obviously we trial and test. We do our research. We look at the data. We personally test it too, which I'm more than happy to be a guinea pig of for most things. And we give it that time before we start to incorporate it into our practice and for our patients.
So you mentioned that both your parents are dentists. What is the best advice they've given you for your career? And what's one thing you thought that you wouldn't do that they've done?
Okay, we're like the one track family dentists. Like my uncle's a dentist too. My other uncle's a doctor. We're all medical. The best bit of advice from my career, they give me loads of good pieces of advice actually. But I think recently, I'll tell you the best things that they've been telling me. I'm an empath. I give quite a lot to my patients, and I have suffered with quite a bit of burnout. And I know it's a very trendy word at the moment. I had burnout before it became cool, but they gave me such good advice about boundaries and how to treat people and what to take on. The first thing my dad always taught me was to treat people as if you were treating a loved one. So what's your why, as everyone says? So I'm here. If I'm here to treat you just to make money out of you, I'm not treating you the right way. Okay. So he called it the board test. So every time he made a clinical decision, he would say to himself, would I do this to Krystyna? Would I do this to my daughters? If he would, then it's the right thing to do. So that was the first thing that I was taught. The second thing that I was taught by my parents is having those boundaries. And of course, just because you can get quite emotionally attached to patients and emotionally involved, it's making sure that you've got that sort of lovely friendship level that's still keeping that professional boundary, because you are obviously looking after these people, and sometimes obviously that can get a little bit blurred. So they're the two bits of advice that they gave me.
It was something that you wouldn't like, that's something that you wouldn't do that you've seen them do.
Okay, this is another very interesting question. My parents owned a dental practice. It was a 2-man band, mum and dad. General dental practice, very lovely. I'm super proud of them because they came from nothing. They worked their way up. I have always been a partner. So at Skin Studio, I have a partnership with the founder. And at my dental clinic, I'm an associate, self-employed. What I don't ever want to do is own a bricks and mortar building. Okay. And that's quite, it took me a while to admit that and say that, because I think there's an expectation that when you get to a certain level in your career, which I'm at, the next thing to do is to have your name above the door. But what I realized for me, with the way I work with patients, how much I give, my burnout, that I actually like to have a bit more freedom and flexibility. So I live half in London, half in Ibiza. And if I had too many foundations here, I would be able to bounce around as much. So what I think that I did differently to my parents is they had one building and it worked from it for 30 years and blessed them, it worked for them. But me, I like a little bit of everything. So I bounce around a bit more.
That's amazing. I know you actually do charity work. We spend part of the year every year providing dental services to people that are less fortunate in different countries. How would you say that differs, and what are your thoughts on that? Like the contrast from that versus the private London clinic scene?
Well, they don't want in Botox in Costa Rica. They don't need it. Yeah, I did actually some with my dad as well. We went to a refugee camp, a Syrian refugee camp, and did some charity work. The latest size it was Costa Rica, done through all these places, Nepal. It's just, it's really important because it gives you that perspective. I work purely in cosmetics and aesthetics, okay, which is not a need that people have. It's a want. People do not need Botox to survive, okay? Do you understand? Like, so it is very bubble, you know, sometimes a bit detached from the real world. So it's important for me, literally it's a personal thing to go and do that as much as I can do, to just have a bit more of a awareness about what's actually going on out there. It helps you not get so wrapped up in the day-to-day gripes, you know, London problems and all that kind of stuff. So it helps me kind of balance my perspective on life. So it really is just a personal thing for me to do that. And he picks some wonderful people, by the way, in his charities. Honestly, truly, they are gorgeous humans out there. Like I remember on the refugee camp, like these are people that had everything. My family are originally Polish refugees from the war, so I kind of have a bit of an affiliation with it all. And the stories that you hear about, like women having children in these tents and camps and stuff, it's amazing. So it kind of gives you a whole new breadth of life on seeing what else is out there, what other people have gone through as well, just from a like that kind of perspective.
No, it's really, really like commendable.
Oh, thank you. Come with me on the next one. We'll do it together. Or choose a nice hot country.
Definitely. You mentioned Botox is not a need, it's a want. What do you think about people considering people getting aesthetic treatments as fake and always maybe insecure?
Hello, spicy question. That's actually a really good question because as much as it's not a need, okay, there are some medical justifications for Botox, grinding, headaches, etc. I am an insecure person. I am incredibly insecure. That's why I've done these things to myself. And it has made me feel more confident, okay, on a daily. They did a study about that recently because, you know, when you get Botox to stop yourself from frowning and people then naturally get out the habit of frowning, they did a study that showed that by doing that, people actually, because they looked happier, they felt happier. Now, look, that's not an upsell to get the Botox, okay? But that's a really good question because, yeah, it's not something that if we didn't have, we wouldn't survive without it. But there is a huge element to say that if it's done, again, for the right reasons, on the right person, you know, someone that hasn't got dysmorphia, etc., that it can be a benefit, you know, and considered a positive treatment. So it's not necessarily fake. That's a good one. Well done on the question.
I'll tell you from my personal experiences. Actually, the reason why I ask is we were asking people of the public, especially men, what they think of women getting these treatments. And they were like, oh, it's fake. Oh, why would they be so insecure? It's on the guy to make them feel like that. And I was thinking, I'm 26. I have had a few treatments. My first one was when I was 21. I got lip filler. I'd had mastered Botox a lot. Again, actually more for the grinding. And if someone was to hear that out of context, they might think she's super insecure. She's,
Well, if you are.
Yeah, no, so what? There's nothing wrong with that. But actually, I was thinking, why did I get these procedures and why do I want to continue? Like, for example, getting polynucleotides, things like that. I would say I work in a startup. I work quite a lot. Sometimes, you know, I don't have so much time to really, really consider what I'm eating, or even if I do, it's more like I know that my skin might be aging like faster. I wasn't aware of what we have available to us, like polynucleotides. That's so cool. Let's go for it. Yeah. So if it produces more collagen, why don't I want that? So yeah, I was thinking, like, it's more that
why do people go to the gym all the time? Exactly. They're going for mental health reasons, of course. But some people go because they want to have a toned body. You know, why do people get their hair done? It's such a good question because I talk about it with a lot of people because you don't want to create insecurities of people because then choosing not to do it. It's okay if you don't want to do it. And then you don't want to make people feel like they're being fake and vain, which are quite negative words, if they do it. It's something that I think still needs to be worked out through it on people. I know personally that, a lot of guys that I speak to about it, they don't want their girlfriends or their wives or, girls to do it or their daughters to do it because they think it's fake. But that's because they are considering the extreme botch work that they've seen out there. I said to my group friend, I was like, he's like, oh, you don't need all that stuff. I was like, you've never known me without it. You don't know where I live without it. And it's true, because I do enjoy it too. So very good question.
How do we change that narrative?
I think it has to come from the person. I think there needs to be I think everyone's going to have an opinion on what anyone does, whether it's aesthetics, whether it's anything else. And I think people are entitled to their opinions. Opinions are valid. Just as long as it's not trolling and negative and mean and cruel, you think what you want to think. But then let people do what they want to do.
Definitely.
That's basically what it is, isn't it?
Yeah, for sure. There's a proportion of people who already have had these treatments done, but there's actually a proportion of people we found that want to get the treatment done, but they have many of these different reasons. One of them being social media and what's portrayed on social media.
Yeah.
How can we actually almost change that narrative on social media? Like if you search Botox and these things, sometimes what you see is the botched jobs or the extreme situations. How would we change that?
And you'll see if people will come into my clinic and show me a photo of somebody else and say, look, I like her lips. I'm like, but they're her lips, So how do we change that message? Well, it's your responsibility as a person who's ever putting any messaging out there. So on my platform, I'm very consistent with my messaging. I treat people naturally. I treat people that's right for them. So I can only do my bit. And I think to change the message, everyone has to be seen from the same hymn sheet. So you just need to follow the people that speak to you and that works for you.
Part of your brand lives on Instagram. We've seen a lot of unqualified injectors with a really, really large following on Instagram. How can we actually show people that potentially the wrong people are the ones with large following on social media?
No, I know, because I have a small and humble following, but it's very engaged. I'm so lucky. I love all my followers. They're my mates. I guess you've got to really deep dive on the social media and also follow it up with websites. People please look at their training, look at their qualifications. It's really interesting. When I first started social media for my business, I do really consider it a business page. I don't consider myself sort of like the influencer or anything like that. I found it so fascinating that people would respond so well to a photo of me out somewhere rather than me talking about my dental qualification, because people are attracted to people. So that's where the danger comes. You see someone who's got a huge following and this kind of life on the page that they would want. They're kind of forgetting to look at what they're trying to promote. Is their work good? Do they have the right qualifications? Because you get sucked into the social media scroll home. So I think it's just about being diligent with what you're looking at.
Since you started your career in the aesthetic space, I'm sure you've seen a lot of change. What's one thing that has really improved over the years?
I was banging my head against the wall for so long with my client, and that's skin boosters. Okay, because when I came into this world, I picked up clients that had just been having Botox every 3 months, and that's all they knew. And then it stopped working for 3 months, and it started working for 6 weeks because it loses efficacy and you build up resistance to it. And so then my entry point to aesthetics, originally was just Botox, but then we were taught about profile over density skin boosters. And I was completely sold. Like I said, without this stuff, I would look like a 55-year-old man. I live off skin boosters. I had them as much as I can. Feed your skin that collagen, hyaluronic acid, amino acids. Go for it. But always avoid that because that is anti-aging your skin. And that was a really hard pivot for my patients to kind of understand. The ones that are just their entry point was Botox. Because Botox works in 2 weeks. Why would I want to have loads of skin boosters? What's that going to do? And until they really got trust in the process and me and saw it on me, it started to get easier. That's less hard now with patients that come in for their first time now, because they've heard about skin boosters. They know about hyaluronic acid because of topical serums and stuff. So that was a real difficult shift.
What is one thing you think is getting worse in the aesthetics industry?
I think the validation that people give non-qualified people. So, for example, and I mean this in the nicest way, if people are getting free treatment and they're potentially advertising or being paid to advertise, but it might not necessarily be appropriate and be with a voice and a platform, that is something that I feel is going backwards. Back in the day, before social media, how people found out about you was word of mouth. So you had someone's genuine approval and recommendation of some you, probably because they've had an experience with that person. Now, sadly, people are being recommended that probably might not be the correct for that situation. Like you say, non-medic injectors being promoted and people talking about them being, having that voice about them. So one thing that I did that's gone backwards, I think, is maybe the advertising of aesthetics. I think it's very easy now these days to promote, you've got Google ads, you've got influencers, you've got social media, you've got paid ads. Whereas back in the day, it was before social media, showing my age, it was word of mouth. So it was personal recommendations based on personal experiences, which is like the golden nugget because you can really trust that. That has value. I feel that has gone backwards quite a lot given the exposure and the platforms available.
Looking ahead 5 years, what is the treatment you think everyone's going to be obsessed with?
Skin. I know they're obsessed with it now. They're going to be more obsessed because you wear your skin every day. It is the first thing that people see. Okay, you could be carrying a Birkin, it's just skin that's nice and glowy. That's what people have been looking for. What have you been doing? Well, how, that is 100% what people will be investing in, or people are going to be advancing in, and what people are always going to be interested in.
And what's one thing we'll be laughing at ourselves for doing in 2025?
I think that we're all going to be laughing at ourselves for tapering off our faces. Do you agree? Yeah, sleeping with these hammocks around our ears, the collagen masks that dissolve in your sleep. Mine always end up on my foot in the morning. I think that's what we're going to be laughing at ourselves for doing. But go for it. Give it a go.
Have you seen Skims have released a balaclava, but it's that thing that's supposed to pull your whole jaw, and
people are starting to sleep like they're in a corpse, and there's the pillow thing. It's getting a bit much now. My night routine is 3 hours these days.
Do you think that actually works at the skin face, whatever?
Let's see. Should we see in 5 years? See you in 5 years.